Debate over the importance of face masks has been reignited in recent days as Omicron appears to challenge related prevention measures. For more, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, welcome back.
Good afternoon.
I also have Dr. Alice Hyung-Young-tan at Ms. Medi Women's Hospital live on the line. Dr. Dan, it's good to see you again.
Thank you for having me.
Dr. Kim, authorities in quite a few places, including states over in the US, are looking to lift their face mask mandates. Do you suppose the worst of the pandemic is over?
Well, I don't think so. But those decisions actually made on the several the background information. The first of all is that they believe that in their condition, their the peak of the infection is is over in their case, and then many people, especially those countries, well, probably everyone on the globe actually complaining about the fatigue about the social distancing measures and then some mask mandate over the 2 years, and then also another factor they are considering is the special feature of this Omicron variant. Obviously, this virus is seems to be very contagious, but seems to cause just a relatively mild disease. And then the immune status has actually just changes over the 2 years. Now that the people got many people got just immunity, whether it is from the vaccination or some natural infection. So those kind of all the factors seem to just affect the decisions in those specific countries and states so far.
Right. And Dr. Dan, face masks, though, have proved to be one of the pillars of our COVID-19 containment efforts, not simply here in Korea, but also over in the US. And having said that, what can you share with us about the related guidelines by health authorities over in the US?
Right. In the US, the CDC, they have made recommendations really for strong mask wearing throughout the country. And these recommendations are based on both direct experimental data and also epidemiological data. In terms of the direct experimental data, they found that when people had universal masking in place, the risk of exposure to aerosols decreased substantially. And also in terms of epidemiological data, communities that had mask mandates in place had decreased transmission levels. The current CDC guidelines state that a person should wear the most protective mask that you can, that fits well on your face, and that you can wear consistently. And they also note that a respirator is a type of mask that has the highest level of protection. And so the CDC, I think they are being very conservative in terms of their mask recommendations. Of course, in public transportation, also people are supposed to be wearing masks at all times.
Right. Back here in Korea, Dr. Kim, officials have said that face masks can be taken off when COVID-19 can be treated like the seasonal flu. How do you interpret these words?
Well, first of all, what they said is that that time that we actually can just take care of all the COVID-19 patients in their local hospitals and the clinics, like we just started to in this Omicron surge, and then when you actually compare to the this is the flu. Just a common cold or flu, that we actually have some annual flu shot, and also we have very successful drugs. So that if anyone just got some flu, there's some system, and then we actually have some full expectation what can be done after just getting the flu. So this kind of things that maybe the managed like the seasonal flu just indicates. And I think, but personally, I think wearing mask is a pretty a good strategy, not year long, but probably just like a winter season. This is when the many respiratory viral diseases is rampant, like a flu. So the just wearing the mask, especially in winter season, actually demonstrate that it's actually very helpful, just preventing many respiratory diseases, like including flu and then other common cold. So I think I would probably just advise wearing the mask, not just a year long, but probably in the winter season.
Right.
In the future, yeah.
And keeping in mind what Dr. Kim has just said, Dr. Dan, keeping in mind that, are there any venues that, or perhaps people who need to wear face masks as we seek to live with COVID-19?
Right, so if you think about location and persons in terms of where masks are recommended. In terms of locations, of course, any indoor location that is poorly ventilated, enclosed, also crowded and in a place where you really have a hard time avoiding close contact, these are the places where you should be wearing a mask. In terms of who should be wearing a mask, even if the risk level goes lower, I would say in terms of what we call source control, so anyone who has a diagnosis, obviously, or symptoms of COVID-19 or an acute respiratory illness, they should be wearing a mask at all times. And then, of course, people who are at high risk for developing severe COVID should be wearing a mask. And those are people who have chronic medical conditions, who are elderly, who are immunocompromised. Chronic medical conditions include obesity, heart disease, chronic lung, kidney, liver disease. These are the people who are at high risk, and so I would recommend that they wear a mask at all times.
Right. And Dr. Kim, taking into account the presence of Omicron, what are your words of advice with regard to the lifting of mask mandates in general?
In general, I think maybe for the short term, just a projection is that, especially in Korea, like after this Omicron surge, and then probably just only in the outside, not just indoors, and it's still just the virus is very just contagious, and especially the place without just a good ventilation, this virus is really just contagious. For the just a long-term projection, well, I do not know. I mean, there are many just variables in addition to this Omicron. We do not know whether any other just the variant might just come with a certain just totally different just features compared to just the previous just variant. So it is hard. I mean, at this point.
Right. And despite your concerns, Dr. Kim, and I'll ask this question to Dr. Tan, of course, British Prime Minister Boris Johnson has spoken about the possibility of an end to self-isolation requirements in England for those who test positive. Dr. Tan, what are your thoughts on this?
Well, I listened to the press report and I listened to his words very carefully, and he did say that it was conditional, that he would consider this if the trend continued. And then also there was a spokesperson for his office who said that that it's not a recommendation that anyone with an acute respiratory disease, COVID or influenza or any other infectious disease, go to work if they're diagnosed, if they have acute COVID. In terms of the trends, it is true that that COVID is on the downturn in the UK. They have 25% decrease in new cases, 20% decrease in new deaths, 11% decrease in new COVID hospital admissions. And so things are improving. However, you run the risk of increasing infection among people who are vulnerable and also among children if you have such a measure as not requiring isolation. Also, we need to consider mortality data. The UK, they have the 6th highest number of COVID deaths per 100,000 people among OECD countries. Right now, it's around 240 deaths due to COVID per 100,000. To put that in perspective, South Korea, our number of deaths per 100,000 for COVID is 13.5. And so it does come down to what number of deaths due to COVID is a country willing to tolerate. If they want to keep their death rates low, then of course restrictions will need to be tighter.
Right, and staying with the death rate, Dr. Kim, on the local front, Korea's soaring caseloads have yet to be reflected in its fatality numbers. How do you explain this silver lining of sorts?
Well, there are actually just two reasons for this kind of just a phenomenon. The first one is this specific the Omicron, and well, according to just a number of just several studies, compared to in contrast to the some earlier just the variants of just the SARS-CoV-2 viruses, the Omicron seems to just replicate only major just principally in the some upper respiratory tract of our just airways, but the other just previous just variants, their main just target area for just viral replication in the lung. So the location of the rapid just viral robust virus replication somehow correlates with the disease severity. So then that's why this is one of the reasons. And the secondly is the effect of the vaccination, including the booster shots. So although due to the just many mutation, more than some dozens of mutations found in the spike protein, this Omicron variant seems to be very effective in evading just the antibody responses, actually, which is also induced by our just vaccination. But then still just the T cell response. This is the T cell response is actually what they do is that this T cell is actually destroy the infected cells. So the antibody main function of the antibody is actually just blocking the infection, but the T cell is actually just destroying the infected cell. So that's just preventing just further the spread of the viruses. So at least the T cell response is still just very robust and effective, and even without just the booster shot, according to just many the studies, up until at least the 6 months, the T cell response is pretty just effective.
And that is very reassuring to know, of course. Dr. Dan, a third of all COVID-19 patients, that is, reportedly suffer from long COVID. Now, what has been shared about the long-term consequences of Omicron?
Well, we don't have a lot of information yet, simply because it's the latest variant of concern, and so it hasn't been around long enough to know. But the preliminary data seem to suggest that there's no reason to think that Omicron COVID makes people exempt from long-haul COVID symptoms. And I'm so glad that you brought this up, because I don't think this is talked about enough in the media, long-haul COVID, post-acute COVID. In a study that was recently published in Nature Medicine, they highlighted some of the cardiovascular complications of COVID-19, and they included heart attack, arrhythmias, blood clots in the lung and in the veins of the leg, cardiogenic shock, heart failure. But beyond even the cardiovascular complications, we have documentation of COVID-19 in people who have symptoms long-term, affecting every single organ system of the body. There are so many unanswered questions about what COVID-19 does long-term. We don't know why people are having symptoms a lot of times, and we don't know how to cure or manage really these patients. And so for anyone who thinks, I heard Omicron is mild and everyone is going to get it at some time, I might as well just give up. I strongly urge you to reconsider, because I don't want people to end up regretting having made that decision and living with long-term symptoms.
Right, which is why prevention should be our priority at the moment then. Dr. Kim, Novavax is now available to the public here. How effective do you expect this COVID-19 vaccine to be in our fight against Omicron?
Well, before just talking about the efficacy against the Omicron, I think we had better just talk about just the result of the phase 3 clinical trials of this Novavax vaccine. They actually Novavax actually just conducted the clinical trial. Phase 3 is from December 2020 to just February 2021. Over these 3 months, they actually just conducted tests almost about just 30,000 people, and then the efficacy was actually just about just 90% just protection efficacy against the all kinds of COVID-19, which is including all mild disease and then moderate and the severe disease. But when we actually consider only just moderate or just severe disease, the efficacy was 100%. But then we have to also consider during that the clinical trial, the major actually just the virus infection during that time was actually, according to their report, is mostly just a variant of interest and then variant of concern, but the predominant one is alpha variant. So at least now from this study, this is very effective against the alpha variant. But then there was actually very recent study just published in Cell by the San Diego research group, and they actually examined all the B cell response, which is actually just antibody responses and also the T cell responses against the some alpha, beta, gamma, delta, and then Omicron, and then from the Pfizer, Moderna, and then the J&J, and then now just Novavax vaccines. And then what they found out is, like I said earlier, just the T cell response is a major actually savior. In this case, for even just Novavax, this is completely different type of just the vaccine platform. They were very actually effective even just against the Omicron because of some of the T cell responses.
Right, I see. And staying with Novavax, Dr. Tan, what can you tell us about its efficacy when used in the manner of cross inoculation?
Right. So You know, there are some people who just have a very difficult time tolerating an mRNA vaccine, and then there are others who have had documented severe adverse events after an mRNA vaccine, such as anaphylaxis, pericarditis, or myocarditis. So these are the people who would be good candidates for receiving Novavax as a booster dose. In terms of the data that support this, there was a COVID boost trial done in the UK, and they looked at the immunogenicity of using Novavax as a booster after having 2 shots of a Pfizer vaccine, so 2 shots of mRNA vaccine, but also they looked at 2 doses of AstraZeneca, and what they found was a booster using Novavax, a full dose of Novavax, showed very good levels of antibody boost response and also cellular immunity boost response with, and this is important, a very nice side effect profile. In other words, no real side effects to be concerned about. And so I think this is very good news because I know a lot of people who are reluctant to get that 3rd dose booster just because they had a bad experience with their either 1st or 2nd doses of an mRNA vaccine.
Right, and hopefully it will then further push up our vaccination rates. Dr. Kim, given the changes in our testing and tracing and treatment strategy in recent days, what do you suppose do we need to keep in mind as we continue to tackle Omicron?
Well, continue just not only just about just Omicron, but generally over just the COVID-19, that this is SARS-CoV-2. I think, well, ultimately we have to think about, in the end, just return back to our just normal life. This is sort of just we are saying just living with the COVID-19. But regarding this, we have a couple of things that we actually have to consider. The first of all is, well, now we have very good just vaccines, but also just the viruses also changes. So in the end, just many experts just agree that this virus would just the viral infection would become just some endemic disease, like some common cold, just the virus is causing common cold. And then in terms of this, we have to think about just how many just the human coronavirus have actually existed so far. There have been a total of 7 the coronaviruses causing the human infectious disease. And that out of the 7, 3 actually cause very severe disease, including now just the SARS-CoV-2 and the original SARS-CoV-1 and also MERS coronavirus. But the other 4 coronavirus, once they might just cause very severe disease. When we actually look at back the some human history just against the many of the infectious disease, but some of them actually now just become the very endemic, just the causative agent for some endemic disease like some common cold. So in the end, we are actually expecting maybe this SARS-CoV-2 would become something like that. But also, well, in order for this way, we actually think about just some annual the vaccination like a flu shot, and also just for this common cold coronavirus, well, we are actually continually just being exposed to this common cold, but without any vaccination. But the thing is that some people say that our just frequent, well, not frequent, maybe it's occasional exposure to the maybe some future variant of SARS-CoV-2 might just play a role as some booster shot effect. So that's kind of a thing that we can actually think about. And also the other aspect that we can actually think about just the vaccination. We have now just many, well, sort of different kinds of the platform for just the vaccines. So that's actually a good thing. And then it can be actually developed for other potential just future infectious disease. And therefore the drugs, although now we have several, but we might have just expect just more just potential just antiviral drugs, not only for just the SARS-CoV-2, but also for other just very related coronavirus or potentially very broad spectrum antiviral drugs in the future.
Right, hopefully.
Yeah.
Dr. Kim, as always, thank you very much for your insights. Dr. Tan, thank you very much for your thoughts today.
Thank you.